Valley Fever Awareness Month in Kern County. And as we look towards next month, it comes at a time when health experts are reporting a dramatic spike in Valley fever cases here in the Southern Valley. One hotspot for new cases, the Lightning in a Bottle Music Festival last May. 5 attendees have been diagnosed with the fungal infection. 3 of them are hospitalized. 17's Connor Dorr joins us in studio with what the experts are saying tonight. Connor?
Michaela, the Lightning in a Bottle Festival is a staple of music and fun, but this time, Valley Fever struck a sharp note in festival goers. The festival brought acts like Skrillex, MIA, and James Blink to Lake Buena Vista, and now at least 5 attendees have been diagnosed with Valley Fever, 3 of them being hospitalized. Valley Fever is a fungal infection that spreads through kicked up dirt, which resides primarily in the southwestern United States. Valley Fever Institute's medical director, Royce Johnson, was not shocked to hear about the outbreak.
I don't think it's incredibly surprising. There have been other local outbreaks that have occurred in a number of locales.
Valley fever can have a wide range of symptoms such as coughing, fever, rash, and shortness of breath. Only a few people end up in the hospital with it, but it can be fatal. Such groups are most at risk.
Well, I think people that are immunocompromised are at the most risk for sure. People that have underlying disease, diabetes to some extent, immunologic disease like rheumatoid disease or lupus, transplant patients. So and then older persons, a bit more males than females. Some racial groups have increased risk. So there are somewhat predictors, but everybody's at risk to some extent.
At the county supervisor meeting today, VFI CEO Scott Thigerson spoke on data with Kern County infections.
When you think of 38 million people in California and our 910,000 people in Kern County, yet we have a third of all of the state's Valley fever cases right here in this community.
While the Lightning in a Bottle Festival was held in May, Valley fever is slow moving and can take weeks to progress. If you suspect you have Valley fever, you can reach out to your doctor for skin or blood tests. In studio, Connor Dorr, 17 News.
Cases of West Nile virus are being detected in humans in several parts of the U.S., with some turning deadly. While Texas has more human cases of West Nile than any other state in the country, right now Michigan is reporting its first human case of the virus this year. The news comes on the heels of a deadly case in California's Bay Area. Health experts say there are things you can do to stay safe.
One thing that does help us here in the United States versus other countries where you have mosquito-borne diseases is we tend to have better housing, screens on our windows, perhaps air conditioning. All of that helps reduce exposure to mosquitoes. But other things you can do is to wear insect repellent. If you're in an area where there is known transmission, whether it's West Nile virus or some other mosquito-borne disease, to wear long sleeves, long pants when you're outside.
Well, the CDC says between 70 to 80% of people infected with West Nile virus don't develop any symptoms. Those who do might experience mild sickness, body aches, fever, or headaches.
In light of the spread of mpox outside DRC and the potential for further international spread within and outside Africa, I have decided to convene an emergency committee under the international health regulations to advise me on whether the outbreak represents a public health emergency of international concern.
If your hospital's hygiene looks like a war zone, you're in serious danger. The hypervirulent superbug, Candida auris, is rapidly spreading across the globe. This dangerous fungus is now in 16 countries, including the UK. What's worse? It's resistant to multiple drugs, making it incredibly hard to treat. Candida auris mainly targets people with weakened immune systems, often those already in hospitals or long-term care facilities. It can survive on surfaces and spread easily in healthcare settings, turning infection control into a massive challenge. The WHO urges strict hygiene practices and early identification to combat this deadly fungus. Healthcare workers and the public need to be more aware and more vigilant. Stay informed, stay safe, and let's work together to stop the spread of Candida auris. Subscribe for more updates.
Just we need a new superbug for the new year, just the arrival of COVID. Bacteria completely resistant to all antibiotics and so forth. Found in, I don't know what they said, 12, 16 countries. But before you get all uppity, this is a Daily Mail, so we're going to dig into this one before we leave too many details.
A moderate earthquake felt by millions of people all across Southern California. The 5.2 magnitude quake hit just after 9 o'clock last night in the small town of Mettler. That's about 90 miles north of downtown L.A. Now, this surveillance video comes to us from a convenience store in Bakersfield. People felt the quake as far south as San Diego. The good news, there have been no reports of any injuries or major damage. Belinda's here now. You're tracking all the seismic activity, and there is a lot to track.
There sure is. It's not out of the question after an earthquake of this magnitude to still feel that ground shake. And I'll take you over to the Central Valley where all of these orange dots are aftershocks. And I think one of the reasons why this earthquake was so widely felt from San Diego all the way into Northern California was because of the depth at 7 miles. So when an earthquake is felt that deep, then it does have a tendency to be able to propagate and to be felt widely.
The Japanese Meteorological Agency has issued a mega quake advisory after a magnitude 7.1 earthquake struck Kyushu Thursday afternoon. It's part of the Nankai Trough Earthquake Extra Information Protocol, which is a precautionary measure ahead of a possible mega earthquake. The agency says there is a higher than usual potential for one occurring in the expected hypocenter of a mega earthquake in the Nankai Trough area. Officials are urging people to take disaster prevention measures in accordance with information provided by the central and local governments. Preparations include reviewing local evacuation plans and routes, as well as ensuring furniture is fixed in place and checking emergency supplies like food and water. This follows analysis conducted by the Japanese government's Earthquake Research Committee. It estimates there's a high chance a magnitude 8 or 9 tremor could happen in the Nankai Trough over the next 30 years. A tsunami advisory remains in effect for Miyazaki Prefecture after Thursday's tremor, which had an intensity of lower 6 on the Japanese scale of 0 to 7 in the hardest hit areas. Officials have advised people in some areas to stay away from the coast. Japan's top government spokesperson says Prime Minister Kishida Fumio has given the government direction on how to respond.
Instructed the government to provide public information on tsunami and evacuations in a timely and appropriate manner, take thorough measures to prevent damage such as evacuations of residents, and grasp the extent of damage as soon as possible. He also instructed us to work closely with local governments and make utmost effort to take emergency measures, such as search and rescue, under the policy of putting human lives first.
Officials say they will provide more information as it becomes available and are advising people to watch for updates.